100%. So because I'm so passionate about helping people live healthier and longer, and it started with myself as a, long kind of founder syndrome, being stressed, being traveling too much, not eating healthy, not moving enough. Years ago, I helped a doctor friend of mine in Cape Town, South Africa, to scale up his own functional medical practice, and it became eventually one of the biggest, if not the biggest, longevity clinic in Cape Town. We have a clinic in Bucharest, Romania,
Okay.
one built one in Miami. Um, but indeed, Expand Health has been, initially was a pet project of mine, a place where I was, experimenting a bunch of biohacks and treatments and bringing friends and family, and eventually became a commercial activity where, it's physical infrastructure, it's medical wellness clinics, but where we try to get much deeper into our clients and patients' symptoms and try to understand the core of the problem, like in any
Right.
functional clinic, but also treat. So the outcome is actually a protocol, which is not a pill, is a months of treatments, lifestyle changes, nutrition, but also things which are more sophisticated. We do peptides and stem cells, and depending on how what the problem is and how can we help these people, these clients, these patients, getting healthier. And
Yeah.
we use technology on top of it. So we have an AI copilot which helps the clinicians to analyze much faster this massive set of data. Um, in terms of diagnostic, in terms of consultations, and then improve the outcome. And this is very different than kind of the conventional medical space where, you go and see your GP for 15 minutes. The GP may not even talk to you, and then the outcome is a prescription with a pill, and you
Mm.
come and see that doctor maybe a year later when you again feel bad. We really try to do a lot of prevention and try to identify the core of the problem and treat the core of the core versus treating the symptom.
Brilliant. And that's so fundamental, isn't it? As you say, it's just a question of pushing over some meds or a prescription to get some meds just to deal with some short-term problem that they might have where they're not getting to the core of that.